Welcome to Entrepreneurs in Healthcare. I've come to realize that entrepreneurship discussions are long overdue in medicine. I'm pairing up with voices from healthcare that value entrepreneurship and that are willing to come on the screen with me and hold a discussion. I'm hoping that hosting these conversations will open up pathways to making progress in medicine and not making entrepreneurship a bad word. Join along on this series as we dissect entrepreneurship, healthcare, and everything in between. Hey everyone, it's Donna Corriel, and I'm back with Entrepreneurs in Healthcare with Dr. Corriel. And across from me virtually is sitting yet a new guest on this coming episode, and her name is Dr. Keira Barr. And Keira, I am actually going to let you introduce yourself before we ask the question of the hour.
Okay. Well, my background is I'm a dual board certified integrative dermatologist who now is focusing on the mind skin connection because a skin issue is never just a skin issue. We're getting to the core of the matter. So
I
that
love
is
that.
what I do now.
And I love that you've kind of like figured out a tagline that really is catchy. So before I note about that tagline, I'm going to ask you the question of the hour, and it's entrepreneurship in healthcare. Is it good or bad?
Hmm. I think depending on the day that you ask me, my answer might change. But I think, how could it be a bad thing in terms of being able to tap into our innate creativity? And I think entrepreneurship, you could spin it either way: an entrepreneur within your healthcare systemic environment versus someone like myself who stepped out of the traditional medical model because practicing medicine in the way that I felt like I had to practice it no longer felt aligned. So it gives freedom and flexibility, but there's challenges with that too.
So let's dissect it. That's perfect. Can you tell everybody, like, give your work situation, your career, like paint us a picture of what your practice actually looks like? Because I'm sure that there are some people listening who don't know you and what you do. So just paint us that picture of your setting.
Yeah, so I have a hybrid model right now. I just took up residence in my local community one day a week at a wellness center. So I'm actually, even though I am not a therapist, mental health providers and licensed therapists because the work that I do is very therapeutic. So it's really, we think about it as like skincare, but really your skin is a reflection of everything happening in your life. There is a lot coming out through the skin that represents a lot of suppressed emotion and challenges and lived experiences. So in person, I can do work with people from what we call a somatic, a body-based approach. So I have pillows, I have props, and it's actually healing in action. And I also have virtual. I can do this work virtually as well.
Okay. Well, I am going to say here that, well, I know Dr. Barr from previous interactions, even before what I'm going to tell you now, because Dr. Barr has been a SoMeDocs network member for quite some time. So first of all, thank you. I want to say that publicly. But I also know Keira Barr on a different level because we recently threw a virtual conference together that has everything to do with what she just described and everything to do with the field of psychodermatology, which I won't say is new, although as an internist, I feel like it is a new concept for me. And I definitely wasn't aware that psychodermatology was even a thing until I teamed up with Dr. Barr to throw this thing. So can you tell us a teeny bit just about psychodermatology and how long it's been out there for?
Yeah, so I mean, if you think about the concept, psycho is the mind, Derm obviously is the skin, and it's the connection between the mind. Our mental health and skin health are not separate. From a scientific perspective, the brain and the skin are derived from the same layer of embryologic tissue. They have an intimate connection. They are communicating with each other all the time. For instance, like, I know you. I should feel comfortable with you. And I've done plenty of podcasts, but my pits are a little sweaty right now. Like, this is real time. My brain is talking to my skin. When you flush, when before a big event, you break out in acne or whatever. This is directly your brain talking to your skin. And so the field of psychodermatology, it really deals with the way that our thoughts, our beliefs, our emotions can influence our physiology, and the outcome is activation of our stress response system, increase in cortisol, adrenaline, and the inflammatory cascade that results from that, and the host of clinical visible skin issues that you will see: psoriasis, eczema, alopecia. Like, these are directly can be tied to stress as being an activating force. There's also conditions where having that condition can create anxiety, depression, and such. Delusions of parasite. So it's really the way that the brain and the skin interact with one another. And this field goes back like so long ago. I mean, you look back at ancient literature, and there was that connection that was being made and mentioned, but as a field, it's relatively new. In the last 40 years, it's really come to the forefront, and most dermatologists even do not get specific training in this. We were taught to outsource to our psychology friends, our psychiatry friends. But what I have found is that they're overwhelmed themselves, our colleagues. And a lot of the treatment that is offered is talk therapy, cognitive behavioral therapy, and pharmaceuticals. But what we know from the research, the brain research, traumatic stress studies research, is that the mind and body are not separate. And only 20% of the information that we receive is like from the top down, the brain to the body. But really, what's happening within us, it's 80% going from the body to the brain. So we have to address the body, what's happening in it, in order to be able to kind of rewire how the body is working, interpreting threats, and working with the stress response system, which is why I take a body-based approach to help people turn off the engine that is driving all the inflammatory condition, which is a dysregulated nervous system.
Super interesting. And for those of you that are listening, I mean, we are here to discuss entrepreneurship, so we're going to get to that next, but I don't want to leave this unsaid that we did have an entire virtual conference on this, and that just because you missed it doesn't mean that you cannot access the footage. And so you can still access the footage. You can still purchase access to it on our website. So you can go to doctorsonsocialmedia.com/conferences, and you can find it down at the bottom in terms of the conferences that have already passed. It's there, it's evergreen, and we've got a ton of speakers that came on and taught us what they know in the field of psychodermatology. So thank you for sharing that. Now, in terms of your practice and entrepreneurially speaking, can you give us a little bit about how you run it especially for the target audience that are doctors listening to this that are curious about, payment structures, whether you take insurance, how you market yourself, et cetera?
Yeah, so I'll name this is a work in progress and evolution, because for a period of time I was really focusing on menopause medicine. And it made sense from a dermatologic standpoint, right? Like, the impact of estrogen and the sex hormones, like, on skin health and hair growth and all that. And so I was marketing from that was like very clinically, medically relevant. I was writing prescriptions and what have you. And so I was working in collaboration with my mentor. And so referrals, that was more of a referral based practice. I was not taking insurance. But because it is a service that is medically important and necessary, a lot of clients were able to use their HSA or FSA accounts. and you can create a letter of medical necessity. In the work that I'm doing now, I'll name that I'm still figuring it out, right? Like, what is psychodermatology? And in fact, I'm not actually calling it psychodermatology because I think that there is still a stigma that is attached for some people that they think there's something wrong with them, that in somehow they are broken. And that is not the case at all. But what we do know, if you look at the literature, childhood trauma, our lived experiences, so much of that has been directly correlated to what's showing up on the skin later in life. So what I have found, like sometimes I'm still figuring it out. It's a little bit challenging for me to articulate at times. So I have found that speaking in groups, getting in front of people, collaborating with similar space folks. So maybe they're a therapist, maybe they're naturopaths, maybe they are other dermatologists, and finding groups of people who share your same population and demographic. And that has been much more effective, kind of than being the lone wolf on your own. So I think something like SoMeDocs is really helpful, where you can create connection, you can find partners to collaborate with, is really helpful.
Good. I'm so happy to hear that. And when you spoke about the stigma that's sort of around a certain name, it kind of touches on a concept in marketing, right? Where we're trying to really figure out what's going to draw in our target audience and our target population. In the case of a practicing physician, it's the patients that they would like to help heal. Sometimes we have to reshape how we address them or how we tackle a topic to make it maybe more palatable or more inviting. And so that's really something that is important for us as, physicians that are embracing entrepreneurship, to better understand. I mean, of course, there's things that you just can't change. You can't always change the truth. And the truth, can be staring you at the face. You can maybe just rename it, so that the person is maybe a bit more comfortable with having that label placed on them.
Yeah, for sure. It's funny. I was just listening to a copywriting, like marketing coach, because I'm still struggling with this. And I think a lot of us as physicians, like when we step into entrepreneurship, this professional hat that we have, and if you are functioning as a physician, like in a direct pay model, you're still wearing that physician hat. But there are many of us who have stepped out and, like, we're a coach, we're a consultant, and we're doing like work adjacent. I know there are many people in our community who maybe they're a sex and relationship coach, but they were like, I don't know, a pediatrician. So you can kind of make that straight separation. But for me, the skin is the lens through which I see everything in the world. But when people ask me, like, will you heal my skin? Are you going to give me something for my skin? I'm like, I'm going to give you the most potent, prescription that there is, which is I'm going to help you feel your feelings so deeply that you are going to want to, like, cry and yell and scream and wail, and it's going to create such a release and such a shift that it just quiets the inflammation. It quiets everything down, right? Can I put that in a marketing page? It's hard to articulate, but we have to be able to speak to the person. This is what the marketing person was saying, like, the right person, you're not talking about your features and your benefits. It's like, can you speak into your who and your why from such a specific place that people are just like raising their hands? And I know for me that has been challenging. Like, I think that's why in many ways I went into dermatology. Skin is all about layers. And so many of us hide under layers of perfectionism and persona and our ego, and it keeps us like in this like lockdown mode. And it can be really scary to shed those and show who we really are, of like, why do you want to heal people? What drove you to that? What in your lived experience created enough pain for you that you were seeking a solution and now you have that solution and you want to share it with other people.
Yeah, I think that what's also hard with entrepreneurs, especially when you are a physician, is that you're suddenly forced to, for example, market for yourself, and you're forced to put yourself out there, which is something so completely different than when we were working for an employer, right? Let's say for the large healthcare systems, and they were sort of marketing us. And so we didn't have to sort of be vulnerable in that sense. We had somebody kind of vouching for us and saying, hey, come and see this incredible doctor. Well, you can't have that as an entrepreneur, not really, not in the same way. When you're the true sense of the true sense of breaking up with the big practices and going out into your own private practice, you've got to promote yourself. And we're just not used to that. It's so out of the box for so many doctors. And we need to learn how to connect with the audience and how to best, word things and how to convey maybe the emotions that patients have when they see us that convince them to keep coming to us. And you can't really do that easily on a piece of paper or through social media. So what ways have you found do work for you? What successes have you had in marketing yourself and trying to convey that emotion that you want a target patient to have, that helps to draw them in?
Yeah, again, I'm not going to claim I have this dialed in. I am still very much learning and iterating. And I think because I am very verbose, like as you can see, like I'm not having good, quick sound bites. So I have found um, podcasts. Like I have my own podcast. It's called The Skinny Dipping Prescription, and it was an opportunity to kind of share my approach, share my philosophy and approach to what I perceive skincare is, and that has been helpful. Being on other people's podcasts and sharing that message. Speaking at conferences, or for me, my demographic is women like me, midlife women, these high achieving women who right, like you've got it all, on paper you've got all the accoutrements and all the things, but there's a felt sense of discomfort in the skin of ours, and sometimes it's just the felt sense, sometimes it's literal symptoms that are showing up. So getting in front of audiences that are your people, I think has been really helpful. So again, that cross pollination, finding other clinicians or practitioners that share who you really want to be serving is, I think, very helpful. Like it's hard to do this on your own.
Absolutely. And do you have a website?
So I do have a website. I need to update it because it's still in my kind of menopause language. And I am struggling. I'm not going to lie. Like, I'm like, all right, how do I word this? How do I want to say this? How do I mesh everything together? And I'm noticing my own default patterns of perfectionism, of trying to just get it just right. So that is an evolution, and I will name that. And this is why we we do our own work alongside. Like I have learned, as a physician, you are the guru. People are coming to you because you have this expertise, and people just want to be told what to do. And as an entrepreneur, I'm like, I'm a guide. I am a guide, not a guru. Like I'm still figuring my shit out. Like just along the way. And if I am one step ahead of you and I can just show you, or I can be a support alongside you, great. So this is this is, yeah, it's a new experience, and it's very uncomfortable because as physicians, we're used to like having the answers.
Absolutely. And also having things kind of paved for us. Again,
Yeah.
like I can think of old times when physicians were kind of, finishing residency and then going out on their own and starting their own private practices. And that just doesn't happen anymore. Specifically thinking back to the episode, I think it was the second episode of the series with Dr. Alejandro Badia, who spoke about that and said that a majority, I mean, he quoted 80% off the top of his head, but he didn't know exactly. But he said a majority of orthopedic surgery residents are coming out and just going straight into employment. And he's trying to sort of change that. And I know a lot of people are in their own fields, but we are trying to kind of get, first of all, discuss that concept of entrepreneurship, right? So it starts with, let's say, a podcast like this to sort of say, is entrepreneurship good or bad? Because you got to kind of push people out and have them talk in the open about what are the good things and what are the bad things. Let's identify them. And that way we can feel comfortable about taking on entrepreneurship because we know what the good things are. But of course, there's not a one size fits all, and there's innovation, and not everybody knows all the answers, and we can redefine what's good and bad as time moves on. And that's what I see. And that's the beauty, right, of innovating in healthcare. It's slow, but you need to have those pioneers sort of pave the way and start things, and then have others follow suit if it truly does work.
Yeah.
So, I've seen a lot of good, and I've also seen bad where it comes to entrepreneurship. But again, I think it's all about the perspective and how you use it, and how you help people, and whether it's, whether it helps other people. Um, I don't know. Do you have anything to say about that little rambling?
Yeah, no, I love that. And it gave me a lot of thoughts of, um, for those of us, medicine was a commitment, but there was like you said, a structure. There was a path. There was a clear, measurable outcome. Mm, Inside that felt created a felt sense of safety and certainty. I know that if I do X, I will get Y, it'll become Z. I'm good. There's security. Great. Many of us thrive in those environments. I was one of those people. I love rules because we're not even going to my past, but like rules worked, a framework and structure worked. Take me out of that, and I have to create my own rules and create my own self trust and create my own felt sense of safety and security. Very dysregulating. Very dysregulating. And you have to know that about that's normal. Nothing has gone wrong, but you have to have tools in place, right? I think everyone should have a coach, everyone should have a therapist. This is why I do the work that I do, because my internal system has learned like how dysregulation feels, how anxiety, how this, and being able to have the tools and be able to pay that forward. I think there's flexibility, there's freedom, but there is lack of certainty. And you have to be able to understand, what is my risk tolerance for that? Or how can I create buffers and mini like safety checks to resource myself enough to move to the next step.
That's so interesting. What's interesting, there's so many points you made that are interesting, but it is interesting to, I've said the word interesting so many times.
Well, I'm glad. I don't want to be boring. I don't want to make this a boring conversation.
The more you say it, the more interesting it will get. No, what I really liked is that you spoke about rule following. That's so true. The majority of us, if not all of us, right? Who goes into medicine? I mean, to some degree, you have to have rule followers because that's what medicine's about. I mean, it attracts the people that really did well in structure, because we had to sort of, you take the SATs, and then you take the MCATs, and then you have to do well in your GPA. And for the most part, you're doing well because you're following the rules. And then forget about it when we're in medical school and when we're in training and residency. Woo, you have to follow the rules because you are so darn scared of the people that are in charge, and what are they going to say about me, and am I going to be able to then get, recommendations, etc. But it does kind of put us outside of our element to leave the comfort of that warm blanket of residency and the people that we train with, and we followed their rules to some degree. And then suddenly you leave and you're not doing what you're supposed to do, which is just get employment and kind of just be that cog. I mean, cogs are good in actual machines, but when you actually consider that it's a machine and that we're doling out health, I don't know that it's so good.
Yeah. And I'll also name that idea of cog in a machine and just the statistics on physician burnout and suicide. I mean, this is not to be taken lightly. I also want to name that entrepreneurship is not some magic pill, magic bullet. Like, we can burn ourselves out super fast in entrepreneurship because of that drive we had in medicine. We take into entrepreneurship of do more, be more, go, 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 go. And like, there is no end of the day. There is no closing out your charts. You had X number of patients and you are done. You can kick your feet up and just take a sigh of relief. The work potentially is never done as an entrepreneur, especially as a solopreneur. If you have to do your marketing, your social media, your email, like be the face of it, the build and like, it could be never ending and you are all the cogs in the wheel, and it can be super fast to burn yourself out. So I just want to name that like, taking care of yourself and self-care is even more important as an entrepreneur, like initially or all along the way, or just as important as it is like being in a big system. Like burnout, physician burnout in healthcare is real. Burnout as an entrepreneur is real. So I don't want to conflate or confuse or like give a false sense of what this experience can be like. I don't know for anyone else. From my own experience, I find that like I've had so many more highs and lows in entrepreneurship than I ever had in medicine. Like, I'm tearing up right now because we don't honor that. We don't honor that. We think like it's supposed to be easy. And in medicine, you know it's going to be hard. You know it's a grind. Those of us who are a little bit older, like there was no 80-hour work week. Like I had, you were working hundreds of hours, like you just knew that was just part of the deal. You never questioned it. You never doubted it. You're just like, girl, just keep going. Wash your face, take a shower, get a nap, go.
We'll be right back. Our Neurodiversity Conference is a conference about people who think differently. Take a listen to our lineup.
Hey, it's Crystal, and I am so excited to be chairing this conference for and about neurodiverse physicians. We're going to talk about some of the different neurodiversities and how they can or potentially can impact your treatment plan.
My presentation will be on sleep strategies for neurodivergent physicians. We'll talk about how the unique gifts and challenges affect sleep.
And I'm excited to share about mindfulness, how to quiet the chatter in your mind and feel more calm and present.
Having a different brain predisposes you to problems and changes some of our novel treatments. In my lecture, you'll learn what those treatment options are, how they differ in people with neurodiversity, and how we can differentiate burnout from actual psychiatric illness.
Whether you have ADHD or not, you can join my class to learn how to optimize your executive function and end procrastination loops.
There are a lot of people out there who are on the spectrum but don't know it. They know they're different, but they don't understand why. And that's what I'm going to be discussing with you.
It's important to remember that this concept of normal or neurotypical is not a value judgment. It's just the most common type of brain, so that's the kind of brain that society is structured around.
To better recognize and support your colleagues who may have ADHD, and that includes yourself as well as perhaps people that you're leading if you're a physician leader.
You can catch this event live for free or access the footage after it's over anytime by purchasing a ticket on our website at doctorsonsocialmedia.com/conferences. Now back to the show.
You were working hundreds of hours, like you just knew that was just part of the deal. You never questioned it. You never doubted it. You're just like, girl, just keep going. Wash your face, take a shower, get a nap, go. And you could resource yourself. There was resilience. As an entrepreneur, somehow I think we delude ourselves into thinking it's not supposed to be that way. You see stuff on social media that it's just to be 4-day work week or 4-hour work week or whatever. And you feel like you're broken and you're doing something wrong when you're working your ass off at 100, So
Yeah.
I just want to normalize that.
I love that.
Changing one for the other, but one may feel a little bit more resonant, a little more aligned because you're living into your values, and that effort is worth it, but it's still work no matter which way you look at it.
So important. Such an important point to make. Yes, yes. It's not easy either way, just because we are discussing that entrepreneurship is good or bad, and especially when we discuss that it is good and should be, taken on head on, it doesn't mean that it's easy. And I absolutely, concur with Dr. Barr to say that it helps when you're not alone, but unfortunately, it is sort of a lonely process right now in the way that healthcare is shaped, because a majority of our colleagues are taking on employed positions. And again, the employed positions can sometimes, it's like a double-edged sword, because it's cushy in that you're no longer alone, but you're also sometimes getting taken advantage of, and you're not your own boss, and you're being told what to do, and you're like, what do I do? If I leave this, then I've got to tackle entrepreneurship and kind of do things on my own. And like, what am I going to do? I've never run a private practice. I've never done it myself. But then if you stay, you've got that cushiness of, well, they're taking care of me, but at some point, are they really taking care of you? And many of us now are kind of pushed to that brink point of like, no, they're not taking care of me. I've got to redefine what it means to practice medicine. And I just look at in my case, it's internists, because I'm an internist, but I look at the internists that have broken off with employers and said, I'm going to do this myself. And I look up to them because they are redefining the space, right? They're shaping the future for our future doctors. And they're brave. It's not easy to break away from tradition.
Yeah, not at all. I think it takes a lot of courage. Um, so I want to honor that. Like when I walked away from traditional, I was in academics, I've been in private practice. Um, and I'll name that as soon as I stepped away and finally took that breath, and we were relocating, so it made it easier. We were moving from California to Washington. And so it was kind of a clean break. My health fell apart right after that. It was like my body had been talking to me, my skin had been whispering. That's why I named my book The Skin Whisperer. It's like your body and skin are talking to you all the time, but we have been conditioned to suppress, to not listen, to turn away from ourselves, to live up here, not in here. But at some point, it's going to become a show. Whether you burn out, your body physically develops chronic disease or symptoms, something has got to give. And I think it takes a lot of courage to have that recognition and that awareness that something is or is not working. And even if you choose to stay inside a system, this is the work, my vision and mission is like redefining what skincare truly is. And skincare, from my perspective, is about relationship. There is a relationship. Your skin is your largest visible organ. It's the boundary between your internal world, your external world. Everything you think, feel, and do comes in contact and affects the skin of ours. So it's about boundaries and such. And this idea that I just lost my train of thought, but there is just such it does take a lot of courage to have that recognition. And even if you stay inside of healthcare, just determining what is that relationship? Can you be in relationship with your circumstance and your situation? How would you want that relationship to change? And most of the time, that's an internal shift, because you cannot control the healthcare system, nor as an entrepreneur can you control what prospective clients think. It's not a metric of your inherent value if someone doesn't want your service. So on both ends of the equation, it becomes about your relationship with what's here for you and your thoughts, beliefs, and sensations of all of that, and getting into, quote unquote, the right relationship for you at this point in time.
That's wonderful. That's really, really wonderful. In fact, it's something I that comes up often with my children, who are getting older now and sort of can make decisions for themselves, are becoming much more independent. I mean, I have an older son that's in college, but I often remind them that you can't really help how someone else acts. I mean, you can certainly voice your frustrations or your anger or your pain to someone else, but at the end of the day, right, what you can control very readily is the way that you react to someone else. And that's sort of what you're speaking about. And it's so, so powerful where it comes to just adulting, so to speak, and just being stronger humans. And of course, also leaving room for self-improvement, self-improvement, and humility, and knowing that you're not the know-all and be-all. And so listening to others, but also again, reminding yourself that you can control only yourself and not others. I'm quickly going to just make it light right now and mention that to the audience that are at least watching, that before we started recording, I told Dr. Barr that I was going to just run over and get some lipstick on. And I literally used the computer to put it on. And I realized this entire time I'm dying because it's totally, it's out of my lips. So I'm like dying to do this and I'm going to do it. Speaking of skin,
That's so funny.
I keep telling myself, stop it. Stop being a perfectionist. So what if your lipstick is outside of your lips? But I'm like,
we'll be right back. Check out our conference called Holistic Skincare: Solutions for Emotional Drivers of Skin Disease.
We're going to take a look at the latest in neuroscience and trauma when it comes to skin disease. And then we're going to not only tie all of this together in a treatment approach to support your patients, but you'll have the opportunity to experience this approach firsthand during our time together.
I'll be talking about how to implement interventions of compassion-focused therapy into therapy of dermatological diseases.
We will be discovering the potential effects of adverse childhood events on our neuroimmunobiology and the chronic spontaneous urticaria pathophysiology.
In this lecture, I'm going to talk about how to classify psychodermatological disorders. I'll also briefly talk about some common psychocutaneous disorders and their management approach.
We will talk about how writing our stories can help us heal, and how chronic stress and emotional pain can affect the skin through the lens of traditional Chinese medicine.
I was psyched when I heard that Somi Docs was putting on a conference all about psychodermatology, and I'm excited to talk to you about how your skin, your gut, and your brain all talk to each other, and how you can do even small things to encourage them to talk more productively.
I first discovered Reiki in 2017, and it completely transformed my life. I'll be giving you very useful, easy, practical tips you can apply in your own practice right away. Plus, energy work is just a lot of fun.
This presentation looks at clinical hypnosis, meeting the largest organ of the body, and where the magic happens.
You will learn about how play is not a diversion, but an active process of healing for stress-driven skin conditions and more.
I hope you'll join me when I talk about the health benefits of laughter and how you can utilize laughter yoga to reap those benefits in your life.
We are going to understand how psychosocial stressors can really impact our coping mechanisms as adults. And through a specific case, I'm going to walk you through methods that are non-pharmacological.
This talk will explore how discovering, experiencing, cultivating, embracing, celebrating, and sharing joy can lead to improved quality of life, connection, empowerment, and advocacy for yourself and others.
Access the footage anytime by purchasing a ticket on our website at doctorsonsocialmedia.com/conferences. Now back to the show.
speaking of skin,
That's so funny.
I keep telling myself, stop it. Stop being a perfectionist. So what if your lipstick is outside of your lips? But I'm like,
And here's such like the perfect thing too, right? You're obsessing over like, oh my God, it's around my lips. I didn't even notice, right? And I think that's a great reminder of like, we get stuck inside ourselves. We're so afraid to take action, to think, myself included, because we think other people are judging us. Like, we are the harshest judge of ourselves. Like, I didn't even notice, right? Like,
you know what?
Like, oh, my hair's very frizzy today. You know, like,
you know what? You know what though? Like, it's so funny that you say that, because you would not say anything to me if you did notice. Like, at the end of the day, we are physicians and we are very polite to one another, and we are really like as a profession. And I want to say this, I want to shout out the doctors out there. You're a good people, right? I mean, that doesn't maybe describe 100% of our cohort, but as a cohort, we really are good people who went into medicine to help others. I think it's important more than ever to say that actually in a series that's focused around entrepreneurship, because some people will try to vilify those of us in medicine and in healthcare who do lean on entrepreneurship to say, well, we're going to take medicine back through entrepreneurial concepts. So I do, want to add that in, that you're just also a really nice person. So even if, I didn't, no, I was going to say, even if I didn't have an earring on and I only had one, when we start recording, I don't know that you would have said anything because you're just.
I probably would have said, hey, like, that's interesting. Or yeah, maybe
Not
not.
if you were recording.
Because that's a style choice. That's a style choice. One earring. But if you had lipstick on your teeth before we started recording, I definitely would.
That's different. That's right. Well, that's different. That's before we recorded. But I'm saying,
like, also, I'm wearing my glasses, but I still can't see all of them. So like, I didn't notice. But if it was dead in your face, maybe like, Donna, there's a little,
yeah, that now you're speaking about my age, because this is my reading glass.
Oh my God, I'm wearing progressives.
Right?
I was like, I can't. I had the readers, and you get 10 pairs. They all wind up in one room. Then you can't see anything anywhere. So I'm like, all right, I'm committing and making the commitment. I'm going to go through the 3 weeks of pain to let my eyes adjust. Here we are.
Gosh. I feel
ourselves as we are.
Totally. I feel your pain. I'm wearing contacts. I'm wearing glasses now on the contacts. Can I do this? Can I do that? My contacts are like getting old. It's
real life
issues.
First world problems, especially entrepreneurship and as physicians too. We're on the screen. Had I not, I think, been glued to my computer, my vision would not be as crappy as it is.
Yes. Huge. Well, listen, my job completely is SoMeDocs. Like I do it 24/7. So I'm either on a computer device or my mobile device. And that's just the reality of my life. So I am seeing my vision just sink down. It'll be interesting to actually see the studies that come out as more of our society depends on screens, about, among other things, vision, if not obviously mental health problems.
And just a little hot skin tip for those of you sitting in front of your computer all the time. Blue light from your devices. Studies have shown it's not as bad as I'm getting the double whammy. I'm in front of my window. Those UVA rays are coming in through, penetrating my dermis, breaking down my collagen, aging me faster. But blue light can do that as well. Blue light has been shown to break down
SPF
hyperpigmentation and fine lines and wrinkles and such. So even if you're indoors wearing a tinted moisturizer, and an SPF, some people like to put their SPF 30 plus separate and then put their tinted product on over it.
We actually had a snafu here. Zoom decided to stop recording.
All right, so we're back, and I apologize. My computer decided that I just have been creating too many podcasts and that I will not be allowed. And I said, absolutely not. I am an entrepreneur, and you do not get to tell me what to do. And so my computer is now obliging. And Dr. Keira Barr was telling us you were just in the tinted.
Yes, it's the tint. It's the iron oxide in the tint that offers the blue light protection. So rain or shine, indoor, outdoor.
Interesting.
If you're sitting in front of a screen, you want to protect that gorgeous mug of yours.
So let me ask you something, and this is totally unrelated to entrepreneurship, but so 30 plus, is that the first layer that you put onto the skin before like your, let's say, tinted moisturizer in your, can you use a foundation that's got SPF in it?
You could, but the likelihood that you're going to get enough coverage with your foundation is probably not. Now, if you're indoors, it probably is, and you want to cover your full face. But if you're going outdoors, getting a SPF 30 and then putting like your tinted foundation on top of that would be recommendation.
And what about a moisture? Like I use Estee Lauder. I think it's 30, but it might be 15, but I use that as the moisturizer that has the SPF in it. Is that?
Yeah. So some of us would say, yeah, that's probably good. But the likelihood, no, when you talk about just sunscreen, data, the vast majority of people only put on 50% of the recommended amount to get the SPF 15. So the likelihood you're actually getting a 15 is small.
Wow.
So, but if you're indoors, like just sitting in front of your screen, it may be enough. It's better than bare skin. But if you're going outside, putting on, either globbing it on, you know, like it's like a teaspoon, kind of like tip of your finger amount on your face. Or just putting on an SPF alone, then putting on your tinted product on top of it.
Good to know. All right. Well, this again has nothing to do with entrepreneurship, but everything to do with what Dr.
It is. As an entrepreneur, you want to put your best foot forward. You want to feel good. You got to take care of. Listen, your skin is a reflection of your overall health and well-being. It's a boundary. Like, you got to take care of the physical barrier, your physiologic, and your psychologic. And that matters. That matters, because if you don't have your health, you cannot show up as an entrepreneur to really move your vision forward. Like, you have to take care of yourself on all levels. So this does matter.
Absolutely.
I can make this relevant.
Yeah. Good for you. I love it. So really, guys, if you're listening and you have any interest in the psychodermatology conference that took place just a few weeks ago, you can still access footage. Dr. Keira Barr was the chair and she was the MC. And so you can watch her, moderate all of the sessions and the incredible guest speakers that were there. Again, that's at doctorsonsocialmedia.com/conferences. Dr. Barr, any last words before we leave, or any ask that you in particularly have?
Yeah, I would name, those listening may think, well, psychoderm doesn't apply to me. And I would say, you are a human living inside this skin of yours. And yes, it does, because the topics that we talked about were laughter yoga, mindfulness, narrative medicine, breath work, somatics, the role that traumatic stress plays on skin and health, right? So, and also being in the role of embodiment, and your presence, your healing presence in the exam room is so key. So even if you think that this doesn't apply, for your own emotional well-being, learning skills of mind-body connection, mindfulness, breath work, it will help you as an entrepreneur. It'll help you as a physician beat burnout. It will help you be able to support your patients heal from the inside out. So from that perspective, just to widen the net of people who may not think, oh, psychoderm, I don't even deal with skin. You have skin, you live in the skin of yours, and it makes an impact on how you move through the world in it. So I would just say, even if you don't think it's relevant, check it out anyway.
Love it. Well, thank you so much. Those are great closing words. And if you, as always, if you enjoyed this episode, please do not hesitate to share it. There will be show notes underneath, and you can link into whatever it is that you wish. Join us, for more episodes. And thank you again, Dr. Keira Barr, for joining.
Thanks so much for listening.